Hi everyone, it's Ryan Liberty, and in this video I'm going to discuss what are depressive disorders. Let's find out. Ooh, Alright, here we are. We're going to discuss what are depressive disorders. The first thing, though, that I need to get out of the way is to mention that these are not the diagnostic criteria for these depressive disorders. These are just really short, brief descriptions of them, so please don't use this information in any way to try and diagnose anybody. And anyway, that should be done by a trained professional, but this is not the information to be using to do that. And also, if the label of any of these disorders bothers you in some way, then you don't have to use the label, you can drop it. It's just there to point you towards what may be going on in your life. So if the label's distressing, if it doesn't help you to heal, just don't worry about the label, don't use the label. So let's get into what are depressive disorders. So the characterizing thing that all these things have in common, all these disorders have in common, is that there is the presence of sad, empty, or an irritable mood, those kinds of feelings. So let's just discuss what each of them is really quickly, and I'll go through them now. I have notes, I'm just looking down to make sure I don't forget anything. We have disruptive mood dysregulation disorder, and that is a persistent irritability that happens in children, and it features outbursts and an angry mood. And specifically, it shouldn't be diagnosed before the age of 6 and after the age of 18 for the first time. We have major depressive disorder, and that is depressed mood nearly every day, and it may feature insomnia and fatigue. You have persistent depressive disorder, also known as dysthymia, and that is depressed mood for most of the day, most days, more days than not, and at least for 2 years, 1 year for children and adolescents. Premenstrual dysphoric disorder is mood lability, irritability, dysphoria, and anxiety, which repeats during the premenstrual phase and which remits during menses or shortly after menses. You have substance medication-induced depressive disorder, which is when you have depressive symptoms and that's arising from taking a substance or a medication. You have depressive disorder due to another medical condition, is when you have those depressive symptoms due to a medical condition. And you have other specified depressive disorder, which is when those depressive symptoms that you may be experiencing don't really fit into any of the other depressive disorders, the categorization for those. And you also have unspecified depressive disorder, which is basically used in emergency room settings when there isn't enough information to go on to make any kind of diagnosis. So these are the depressive disorders. Again, they all center around having a depressed, empty, sad feeling. And I hope that giving this quick little rundown of them has helped you to maybe point you in the right direction of what may be going on in yours or a loved one of yours' life. I hope that they have helped you. If you have any questions or comments, please leave them below, and I'd love to hear from you. I thank you for joining me to learn about them today. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.